Hello, and welcome to the Holistic Cancer Care Channel. I'm Dr.MemetIşık, a cancer researcher passionate about exploring innovative treatments and holistic approaches to cancer care. Did you know that two common antiparasitic drugs, Fenbendazole and Ivermectin, are gaining attention for their potential in cancer treatment? Could the solution to fighting cancer already be in our medicine cabinet? Today, we're diving into the fascinating world of repurposed drugs and their role in alternative cancer therapies. In this video, you'll learn how these drugs are thought to work against cancer, their potential benefits, and what the latest research says. Plus, we'll outline some of the protocols that people are discussing. Stick around to separate the facts from fiction and make informed decisions. Before we continue, a quick but important note. This video is for informational purposes only, and is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your treatment plan. Could common anti-parasite drugs hold the key to fighting cancer? This question, once unthinkable, is now being seriously investigated in labs and clinics around the world. Fenbendazole, a drug used to deworm pets, and ivermectin, a medication for parasitic infections in humans and animals, are showing surprising potential in the fight against cancer. While early research and anecdotal reports offer a glimmer of hope, the scientific community urges caution, emphasizing the need for rigorous clinical trials to confirm these findings. This exploration into repurposing existing drugs for cancer treatment represents a new frontier in medicine, one that could revolutionize the way we approach this complex disease. This unexpected turn of events raises many questions. From parasites to cancer cells. Understanding the shift. Fenbendazole and ivermectin belong to a class of drugs known as anthelmintics, agents that expel parasitic worms and other internal parasites from the body. For decades, they have been widely used in veterinary and human medicine, with proven safety and efficacy in treating a range of parasitic infections. So, how did these anti-parasitic drugs become entangled with cancer research? The answer lies in their unique mechanisms of action. While their primary targets are parasites, both fenbendazole and ivermectin have been found to interact with cellular pathways that are also crucial for cancer cell growth and survival. This unexpected overlap has sparked immense interest in exploring their potential as repurposed cancer therapies. Researchers are now investigating whether these drugs, originally designed to combat parasites, can be effectively deployed against cancer cells. How they work. Disrupting cancer at the cellular level. Fenbendazole and ivermectin interfere with cancer cell growth and survival through different but potentially complementary mechanisms. Fenbendazole primarily disrupts the formation of microtubules, essential components of the cell's structural framework. These microtubules play a crucial role in cell division, ensuring the equal distribution of genetic material to daughter cells. By disrupting microtubule formation, fenbendazole effectively prevents cancer cells from dividing and proliferating, ultimately leading to their death. Fenbendazole also inhibits glucose metabolism. Cancer cells rely heavily on glucose, and fenbendazole may interfere with this metabolic pathway. Ivermectin, on the other hand, exerts its anti-cancer effects by inhibiting the Wnt-bcatenin signaling pathway, a critical pathway involved in cell growth, proliferation, and survival. The Wnt-bcatenin pathway is often dysregulated in cancer, leading to uncontrolled cell growth and tumor formation. By blocking this pathway, ivermectin can potentially halt the growth of cancer cells and induce apoptosis, a form of programmed cell death. These mechanisms of action, while complex at the molecular level, underscore a fundamental principle. Cancer cells, despite their uncontrolled growth and ability to evade normal cellular controls, are still vulnerable to disruptions in key cellular processes. Promising findings but more research needed. A look at the evidence. The potential of fenbendazole and ivermectin in cancer treatment is supported by a growing body of preclinical studies, mostly conducted in vitro, in laboratory settings, and in vivo, in animal models. These studies have demonstrated the ability of these drugs to inhibit the growth of various cancer cell lines, including urinary tract cancer, lung cancer, breast cancer, and colon cancer, among others. However, it is important to note that these findings are preliminary and do not necessarily translate to similar effects in humans. Anecdotal reports from individuals who have used fenbendazole or ivermectin as alternative cancer treatments have also surfaced, claiming significant tumor regression and even complete remission. While these accounts are intriguing, they are anecdotal and should be interpreted with caution. Anecdotal evidence is inherently subjective and lacks the rigorous controls of scientific studies, making it difficult to determine whether the observed effects are directly attributable to the drug or other factors. Despite these encouraging preliminary findings, it is crucial to emphasize that much more research is needed to determine the safety and efficacy of fenbendazole and ivermectin in humans with cancer. Rigorous clinical trials are essential to evaluate their therapeutic potential, determine optimal dosages, and identify potential side effects. Potential treatment protocols and risks. Navigating uncharted territory. Due to the lack of established clinical guidelines for using fenbendazole and ivermectin in cancer treatment, potential treatment protocols are largely based on anecdotal evidence and preclinical data. These protocols often involve using human-grade formulations of the drugs, or in some cases, repurposing veterinary formulations, which poses additional risks due to potential differences in purity and dosage. The absence of standardized protocols and clinical trials makes it challenging to define specific treatment regimens, including dosages and durations. Furthermore, the potential side effects of using these drugs for cancer treatment are not well understood. While generally considered safe at doses used for parasitic infections, higher doses or prolonged use, as might be the case in cancer treatment, could lead to unforeseen side effects and toxicity. It is crucial to reiterate that using fenbendazole or ivermectin for cancer treatment is experimental and not without risks. Self-medicating with these drugs, especially without proper medical supervision, can be dangerous and potentially harmful. Let's dive into one of the suggested anecdotal protocols for using fenbendazole in cancer treatment. Please note, this is not medical advice but is based on commonly discussed practices shared within the alternative therapy community. The protocol typically involves taking a daily dose of 222 milligrams of fenbendazole, which is equivalent to 1 gram of 22.2% fenbendazole powder. This is taken orally. The regimen follows a 3 days on, 4 days off schedule each week. This cycling approach may help minimize potential side effects. Additionally, it's often suggested to combine fenbendazole with other supportive supplements, such as 600 milligrams of curcumin, 400 international units IU of vitamin E, and optionally, CBD oil. These may enhance anti-cancer activity and reduce oxidative stress. The duration of this protocol is typically continued for several weeks or months as an adjunct to other treatments. However, individual responses can vary greatly. Now let's take a closer look at the suggested protocol for ivermectin as a potential cancer therapy. Once again, this information is based on anecdotal and experimental reports and is not intended as medical advice. The dosage of ivermectin typically falls between 0.2 to 0.4 milligrams per kilogram of body weight. This dose is taken orally 2 to 3 times per week. The regimen is usually cyclical, for example, 2 days on and 5 days off each week. This approach aims to minimize potential toxicity while maintaining its therapeutic effects. For enhanced efficacy, ivermectin is sometimes used in combination with fenbendazole or other therapies. This combination is believed to have a synergistic effect against cancer cells in anecdotal reports. Remember, this protocol is based on anecdotal evidence and is not a substitute for professional medical care. It's important to emphasize that these protocols are not part of standard medical practice and require careful consideration. Always consult with a qualified healthcare provider before using fenbendazole, ivermectin, or any other repurposed drugs for cancer treatment. While preliminary research and anecdotal reports offer a glimmer of hope, they are not a substitute for rigorous scientific evidence. If you are considering using fenbendazole or ivermectin as part of your cancer treatment, it is absolutely essential to consult with your doctor or a qualified oncology specialist. They can provide evidence-based guidance, assess potential risks and benefits based on your individual medical history, and monitor your progress closely. This essay is intended for informational purposes only, and should not be construed as medical advice. Thank you for watching. If you found this video insightful, don't forget to give it a thumbs up. It helps support our channel. Hit the subscribe button and turn on the notification bell so you never miss an update on our latest educational content. And please share this video with your friends and family to help spread awareness and knowledge. Together, we can make a difference. Thanks for your support and see you in the next video.